Question 1. When transferring a patient from the bed to a wheelchair, what is the primary safety measure the patient care technician, PCT, should implement? A. Ensure the wheelchair brakes are locked. B. Ask the patient to stand on one leg. C. Use a gait belt only if the patient is dizzy. D. Lower the head of the bed completely. Answer: A. Ensure the wheelchair brakes are locked. This question tests patient safety during transfers, a core PCT responsibility. The keyword primary safety measure points to the most crucial step. Locking the wheelchair brakes prevents the chair from rolling, which could cause a fall or injury to the patient or PCT. Using a gait belt is also important, but securing the wheelchair itself is the foundational step before any movement occurs. For example, if the wheelchair moved unexpectedly while the patient was standing, it could lead to a serious accident. Always double-check that the wheels are secured before starting any transfer. Question 2. A patient's urine specimen needs to be tested for a culture and sensitivity, C and S. Which type of urine collection is most appropriate for this test? A. First morning voided specimen. B. Random urine specimen. C. Clean catch midstream specimen. D. Timed urine specimen. Answer: C. Clean catch midstream specimen. This question addresses specimen collection, specifically for a urine culture. The keywords culture and sensitivity indicate the need for a sample relatively free from contamination. A clean catch midstream specimen involves cleansing the urinary meatus and collecting the urine sample after the initial stream has started, minimizing contamination from skin bacteria. This ensures the lab gets an accurate count of bacteria causing a potential urinary tract infection. For example, collecting urine this way prevents skin bacteria from being mistakenly identified as the cause of infection. It's important to follow these steps for accurate diagnostic results. Question 3. Which piece of personal protective equipment, PPE, must be worn when anticipating splashing or spraying of bodily fluids? A. Face mask. B. Goggles or face shield. C. Gloves only. D. Disposable gown. Answer: B. Goggles or face shield. This question focuses on infection control and the correct use of PPE. The phrase splashing or spraying of bodily fluids is the key clue. Goggles or a face shield protect the mucous membranes of the eyes from contamination, which is a primary route for certain infections. While gloves and gowns protect the skin and clothing, and masks protect the respiratory tract, only eye protection specifically guards against splashes to the eyes. For instance, wearing eye protection during wound care helps prevent fluid from entering the eyes. Always select PPE based on the specific task and potential exposure. Question 4. A patient is experiencing shortness of breath. What position should the PCT assist the patient into to ease breathing? A. Supine position, lying flat on the back. B. Fowler's or semi-Fowler's position, sitting up. C. Prone position, lying on the stomach. D. Trendelenburg position, lying on back with feet elevate. D. Answer: B. Fowler's or semi-Fowler's position, sitting up. This question relates to patient comfort and respiratory support. The key symptom is shortness of breath, indicating difficulty breathing. Sitting upright, known as Fowler's or semi-Fowler's position, allows the diaphragm to move down more freely and the chest wall to expand fully, making breathing easier. The other positions restrict lung expansion. For example, helping a patient lean forward slightly while sitting up can further improve comfort. Positioning patients correctly is a simple yet effective way to support their respiratory needs. Question 5. What is the most important action a PCT should take before phlebotomy, drawing blood? A. Ask the patient to state their name and date of birth. B. Check the expiration date on the blood tubes. C. Ensure the patient has eaten a full meal. D. Select the largest vein available. Answer: A. Ask the patient to state their name and date of birth. This question emphasizes patient identification, a critical safety step in all healthcare procedures. The keywords most important action and before phlebotomy highlight the need for correct patient identification. Misidentification can lead to serious errors, such as drawing blood from the wrong patient or labeling it incorrectly. Verifying the patient's name and date of birth using their ID band ensures the correct sample is collected from the correct person. For example, confirming "Are you John Doe, born January 1st?" with the patient directly is vital. Always confirm patient identity before proceeding. Question 6. How should a PCT properly dispose of used bandages or dressings contaminated with blood? A. Flush them down the toilet. B. Place them in the regular trash bin. C. Dispose of them in a biohazard waste container. D. Rinse them thoroughly before discarding. Answer: C. Dispose of them in a biohazard waste container. This question addresses waste disposal and infection control. The crucial information is contaminated with blood. Items soiled with bodily fluids like blood are considered potentially infectious medical waste and must be placed in a designated biohazard container to prevent the spread of infection. Flushing, regular trash, or rinsing are incorrect and unsafe practices. For instance, used dressings should go directly into the red biohazard bag or bin. Treating all potentially infectious waste safely protects everyone in the facility. Question 7. A patient has an order for vital signs every 4 hours. The patient's blood pressure is 80/50 mmHg. What should the PCT do? A. Record the reading and continue routine monitoring. B. Recheck the blood pressure after 15 minutes. C. Report the reading immediately to the nurse. D. Offer the patient a glass of water. Answer: C. Report the reading immediately to the nurse. This question tests the PCT's understanding of vital sign parameters and reporting responsibilities. The key clue is the blood pressure reading of 80/50 mm of mercury, which is significantly low, hypotension. Such a low reading requires immediate attention from a licensed nurse to assess the patient's condition and determine the cause. Simply recording it, rechecking without reporting, or offering water might delay necessary intervention. For example, a sudden drop in blood pressure could indicate serious issues like bleeding or dehydration requiring prompt medical evaluation. Always report critical vital sign values right away. Question 8. What is the purpose of applying a tourniquet during phlebotomy? A. To numb the venipuncture site. B. To slow blood flow into the arm. C. To distend, swell, the veins, making them easier to find. D. To prevent bleeding after needle removal. Answer: C. To distend, swell, the veins, making them easier to find. This question deals with the technique of phlebotomy. The keyword tourniquet and its purpose are being assessed. Applying a tourniquet constricts venous blood flow, causing the veins in the upper arm to become more prominent and easier to palpate, feel, and visualize for needle insertion. It does not numb the area, slow blood flow significantly, or prevent bleeding post-venipuncture. For instance, feeling for a bouncy, prominent vein after applying the tourniquet correctly helps ensure a successful blood draw. Remember, The tourniquet helps make the vein pop out. Question 9. Which action demonstrates proper body mechanics when lifting a heavy object? A. Bending at the waist with straight knees. B. Lifting with the back muscles. C. Keeping the feet close together for balance. D. Bending at the knees and keeping the back straight. Answer: D. Bending at the knees and keeping the back straight. This question evaluates understanding of safe patient handling and body mechanics. The key phrase is proper body mechanics when lifting. Bending at the knees and maintaining a straight back utilizes the stronger leg muscles for lifting, minimizing strain on the back. Bending at the waist or using back muscles puts the spine at high risk for injury. Keeping feet wide apart provides a stable base. For example, imagine lifting a box off the floor. Bending your knees lets you use your leg power. Use your legs, not your back, to lift safely. Question 10. A patient is NPO, nothing by mouth. What does this order mean for the patient? A. The patient can only drink clear liquids. B. The patient must eat a low-sodium diet. C. The patient is allowed no food or fluids by mouth. D. The patient must eat small, frequent meals. Answer: C. The patient is allowed no food or fluids by mouth. This question tests the understanding of common medical abbreviations. The abbreviation NPO is the focus. NPO stands for nil per os, which is Latin for nothing by mouth. This means the patient cannot eat or drink anything, including water, unless specifically ordered otherwise. Options A, B, and D describe different types of diets. For instance, a patient scheduled for surgery would typically be NPO for several hours beforehand. Always clarify NPO status means absolutely nothing by mouth. Question 11. What is the primary purpose of using sterile gloves during certain procedures? A. To provide a better grip on instruments. B. To protect the PCT's hands from chemicals. C. To prevent the introduction of microorganisms into the patient's body. D. To keep the patient's skin clean. Answer: C. To prevent the introduction of microorganisms into the patient's body. This question concerns surgical asepsis, sterile technique. The keywords sterile gloves and procedures point towards preventing infection. Sterile gloves create a barrier that prevents pathogens, disease-causing microorganisms, from entering a sterile body cavity or the bloodstream during invasive procedures. While they offer some protection to the PCT, their main function is maintaining sterility for the patient's safety. For example, during urinary catheter insertion, sterile gloves prevent bacteria from entering the bladder. Remember, sterile means microbe-free for patient protection. Question 12. When measuring a patient's oral temperature, where should the thermometer probe be placed? A. Under the patient's tongue, toward the side of the mouth. B. Directly under the center of the tongue. C. Between the cheek and gums. D. On top of the tongue. Answer: B. Directly under the center of the tongue. This tests the correct technique for taking an oral temperature. The key action is placing the thermometer probe under the center of the tongue. This location provides the most accurate core temperature reading because it's rich in blood vessels. Placing it too far to the side or between the cheek and gums can lead to inaccurate, lower readings. For example, ensuring the probe is sealed by the patient's lips ensures optimal contact with the sublingual pocket. Proper placement is crucial for accurate temperature measurement. Question 13. A PCT is assisting a patient with ambulation, walking. What is the correct position for the PCT relative to the patient? A. slightly behind and to the side of the patient. B. Directly in front of the patient. C. Facing the patient with hands on their shoulders. D. One step ahead of the patient. Answer: A. Slightly behind and to the side of the patient. This question focuses on safe patient ambulation assistance. The core concept is providing support while maintaining safety. Positioning the PCT slightly behind and to the side allows the PCT to act as a steadying force if the patient stumbles or weakens, preventing falls. Being directly in front or ahead makes it harder to catch the patient. For example, holding onto a gait belt from this position offers maximum stability. Walking slightly behind ensures you can catch them if they start to fall forward. Question 14. What is the normal range for adult respiration rate? A. 12 to 20 breaths per minute. B. 60 to 80 breaths per minute. C. 80 to 100 breaths per minute. D. 20 to 30 breaths per minute. Answer: A. 12 to 20 breaths per minute. This question assesses knowledge of normal vital sign ranges for adults. The specific vital sign is the respiration rate. The generally accepted normal range for a resting adult respiratory rate is 12 to 20 breaths per minute. Rates significantly outside this range often indicate a potential health issue. For example, breathing 25 times a minute might require notifying the nurse, while 15 breaths per minute is typically normal. Knowing these baseline values is essential for recognizing changes. Question 15. HIPAA is a regulation focused on protecting what? A. Patient safety during procedures. B. Healthcare worker safety. C. Patient privacy and confidentiality of health information. D. Billing and insurance processes. Answer: C. Patient privacy and confidentiality of health information. This question tests understanding of important healthcare regulations. The acronym HIPAA specifically refers to the Health Insurance Portability and Accountability Act. Its primary purpose is to safeguard sensitive patient health information, PHI, from unauthorized disclosure. Keywords like privacy and confidentiality are central to HIPAA's function. For example, discussing a patient's condition in a public hallway would violate HIPAA. Protecting patient information is a legal and ethical requirement for all healthcare staff. Question 16. When performing mouth care for an unconscious patient, which position is safest to prevent aspiration? A. Supine with the head elevated slightly. B. Side-lying, lateral, position with the head tilted down. C. Side-lying, lateral, position with the head turned slightly. D. Semi-Fowler's position. Answer: C. Side-lying, lateral, position with the head turned slightly. This question relates to providing basic patient care and preventing complications. The key factors are unconscious patient and preventing aspiration, which means inhaling fluid or vomit into the lungs. The side-lying position allows any fluids or secretions in the mouth to drain out naturally, rather than entering the airway. Elevating the head too much or placing them flat on their back increases the risk. For example, turning the patient onto their side ensures liquids pool in the cheek area, away from the throat. Always position an unconscious patient on their side for oral care. Question 17. A PCT is asked to collect a sputum specimen. What should the patient do before coughing to produce the specimen? A. Drink a large glass of water. B. Rinse their mouth with water. C. Take several deep breaths and cough forcefully. D. Use cough drops to loosen phlegm. Answer: C. Take several deep breaths and cough forcefully. This question focuses on the correct procedure for collecting a sputum specimen, which is mucus coughed up from the lungs. The keywords sputum specimen and produce highlight the need for effective coughing. Taking deep breaths helps mobilize secretions from deeper within the lungs, and a forceful cough brings the sputum up effectively. Rinsing the mouth first prevents contamination of the specimen with saliva or food particles. For example, encouraging the patient to inhale deeply twice and then cough on the third breath can yield the best results. Deep breaths followed by a strong cough are key for a good sample. Question 18. What is the most common site for taking an adult patient's pulse? A. Brachial artery, inner elbow. B. Carotid artery, neck. C. Radial artery, wrist. D. Dorsalis pedis artery, top of foot. Answer, C. Radial artery, wrist. This question assesses basic knowledge of vital signs measurement. The keywords most common site and adult pulse point to the radial artery. The radial artery is easily accessible at the wrist and provides a reliable pulse reading. While other sites like the carotid or brachial arteries can be used, the radial artery is the preferred location for routine pulse checks due to convenience and accessibility. For example, resting 2 fingers gently on the thumb side of the wrist allows you to feel the pulse wave. The radial pulse is the standard choice for routine checks. Question 19. A patient has restraints applied. How often should the PCT check on the patient and document the check? A. Every 15 minutes. B. Every 30 minutes. C. Every 1 to 2 hours, per facility policy. D. Once per shift. Answer, C. Every 1 to 2 hours, per facility policy. This question addresses safety protocols related to patient restraints. The keywords restraints applied and how often check are crucial. Patients in restraints require frequent monitoring to ensure their safety, comfort, and circulation, and to check for the need to remove or reposition the restraints. Facility policies typically mandate checks every 1 to 2 hours, involving assessment of skin, circulation, and the reason for the restraint. For example, checking the skin under the restraint straps for redness or irritation is essential during each check. Always follow your facility's specific policy for restraint checks. Question 20. Which temperature measurement method is generally considered least accurate for core body temperature? A. Tympanic, ear. B. Temporal artery, forehead. E. C. Oral. D. Axillary, armpit. Answer, D. Axillary, armpit. This question evaluates knowledge of different temperature measurement techniques and their accuracy. The keyword least accurate is important. Axillary, armpit, temperature readings are taken on the skin surface and are most affected by environmental factors, therefore, they tend to be less reflective of true core body temperature compared to oral, rectal, tympanic, or temporal methods. For instance, an axillary reading might be a degree lower than the actual core temperature. Always consider the limitations of axillary temperatures. Question 21. What does the S typically stand for in the SOAP note format? A. Subjective information reported by the patient. B. Specific diagnosis of the condition. C. System review performed by the nurse. D. Scheduled interventions for the day. Answer. A. Subjective information reported by the patient. This question tests familiarity with common medical documentation formats. The focus is on the S in SOAP. SOAP stands for subjective, objective, assessment, and plan. The subjective component includes information reported directly by the patient, such as their symptoms, feelings, or concerns, often in their own words. For example, "My head hurts" is subjective data. Objective data is what the PCT or nurse observes or measures, like vital signs. Understanding SOAP helps in effective patient charting. Question 22. A PCT notices a frayed electrical cord on a piece of patient equipment. What is the immediate action the PCT should take? A. Tape the frayed cord securely. B. Cover the cord with a cloth. C. Remove the equipment from use and report it. D. Continue using the equipment but monitor it closely. Answer: C. Remove the equipment from use and report it. This question pertains to patient safety and equipment maintenance. The critical clue is a frayed electrical cord. Frayed cords pose a significant risk of electrical shock or fire. The PCT's immediate responsibility is to prevent harm by removing the damaged equipment from service and reporting the hazard to the appropriate person, like the nurse or biomedical department. Taping or covering the cord is unsafe and does not eliminate the risk. For example, unplugging the faulty equipment and tagging it "Do not use" is standard procedure. Always remove potentially unsafe equipment immediately. Question 23. When assisting a patient with a meal, what is a key step to ensure safety and proper nutrition? A. Feed the patient as quickly as possible. B. Cut the food into very small pieces regardless of the patient's ability. C. Allow the patient to self-feed as much as possible and assist as needed. D. Only offer liquids if the patient struggles with solid food. Answer: C. Allow the patient to self-feed as much as possible and assist as needed. This question relates to patient independence and care during mealtime. The keywords assisting with a meal and safety and proper nutrition are important. Promoting independence by allowing the patient to self-feed promotes dignity and maintains muscle function, and the PCT provides assistance only where needed, like cutting food or reaching items. Rushing the meal or automatically cutting food small undermines autonomy. For example, cutting meat only if the patient has difficulty chewing ensures their preferences and abilities are respected. Encourage independence whenever possible during feeding. Question 24. What is the primary purpose of documenting care provided to a patient? A. To justify the charges billed to the patient. B. To provide a legal record of care and communicate information to the healthcare team. C. To create a list of tasks for the next shift. D. To track the patient's response to treatments only. Answer: B. To provide a legal record of care and communicate information to the healthcare team. This question addresses the importance of documentation in healthcare. The keywords "purpose of documenting care" highlight its multifaceted role. Accurate and timely documentation serves as a legal record of the services performed and findings, and it is essential for effective communication among all members of the healthcare team, ensuring continuity of care. While it relates to charges and patient responses, its primary functions are legal accountability and interprofessional communication. For example, documenting vital signs allows the next nurse to see the patient's status trend. Your notes are vital for continuity and legal protection. Question 25. A patient has fallen and appears conscious but is bleeding from the head. What should the PCT do first? A. Help the patient sit up immediately. B. Apply direct pressure to the bleeding site. C. Call for the nurse and stay with the patient. D. Check the patient's pulse and breathing. Answer: C. Call for the nurse and stay with the patient. This question assesses emergency response priorities. The situation involves a fall with bleeding, requiring immediate assessment and action. The very first step is to ensure help is on the way by calling for the nurse, who can then assess the full situation and direct further care. Staying with the patient prevents them from moving and potentially worsening their condition. Applying pressure or checking vitals should follow after alerting the nurse. For example, calling nurse, "I need assistance in room 202, patient has fallen," ensures help arrives quickly. Always ensure help is coming before taking other actions in an emergency. Question 26. Which condition is characterized by difficulty breathing when lying flat? A. Orthopnea. B. Dyspnea. C. Tachypnea. D. Bradypnea. Answer: A. Orthopnea. This question tests knowledge of medical terminology related to respiratory conditions. The key term is difficulty breathing when lying flat. Orthopnea is specifically defined as shortness of breath that occurs when lying flat and is relieved by sitting or standing upright. Dyspnea is general shortness of breath, tachypnea is rapid breathing, and bradypnea is slow breathing. For example, a patient with heart failure might need to sleep propped up on several pillows due to orthopnea. Remembering that ortho relates to upright posture helps link it to this condition. Question 27. What is the correct technique for using a fire extinguisher? Pass. A. Pull, aim, smother, sweep. B. Push, activate, squeeze, spray. C. Pull, aim, squeeze, sweep. D. Press, aim, smother, spray. Answer: C. Pull, aim, squeeze, sweep. This question covers emergency preparedness, specifically fire safety. The acronym PASS is the standard mnemonic for fire extinguisher operation. P stands for pull the pin, A for aim the nozzle at the base of the fire, S for squeeze the handle, and the second S for sweep the nozzle from side to side. Knowing this sequence is crucial for effective fire suppression. For example, aiming at the base targets the fuel source of the fire. Always remember PASS to fight fires safely. Question 28. When cleaning a patient's dentures, the PCT should: A. Use hot water to sterilize them. B. Place them in a cup without water. C. Use a clean toothbrush and denture paste/mild soap. D. Leave them soaking in mouthwash overnight. Answer: C. Use a clean toothbrush and denture paste/mild soap. This question addresses proper hygiene techniques for patients with dentures. The keywords cleaning dentures are key. Dentures should be cleaned gently using a soft toothbrush and mild soap or denture cleaner to avoid damaging the material. Hot water can warp them, and soaking them dry or in harsh solutions is inappropriate. For example, gently brushing all surfaces ensures removal of food particles and plaque. Handle dentures carefully and clean them thoroughly but gently. Question 29. What is the primary purpose of using a gait belt during ambulation? A. To provide a secure place for the patient to hold on to. B. To help the PCT lift the patient more easily. C. To assist and support the patient while preventing falls. D. To measure the patient's balance. Answer: C. To assist and support the patient while preventing falls. This question focuses on the function of a gait belt in patient mobility. The keywords gait belt and ambulation highlight its use. A gait belt is placed around the patient's waist and provides the PCT with a secure handle to assist with balance and support the patient's center of gravity, thereby preventing falls during walking. It's not primarily for lifting or for the patient to grab. For example, the PCT can use the belt to steady the patient if they start to lose balance. Gait belts are essential tools for safe walking assistance. Question 30. Which angle is typically used for the intradermal, ED, injection route? A. 15 degrees. B. 45 degrees. C. 90 degrees. D. 10 to 15 degrees. Answer, D. 10 to 15 degrees. This question tests knowledge of different parenteral administration routes. The focus is on the angle for an intradermal injection. Intradermal injections are given into the dermis, the layer just beneath the epidermis, skin surface. The needle is inserted at a shallow angle, typically 10 to 15 degrees, creating a small bleb or wheal on the skin. Angles like 45 or 90 degrees are used for subcutaneous or intramuscular injections, respectively. For example, allergy testing uses the ID route. Remember, ID means in the dermis, hence the shallow angle. Question 31. A patient reports feeling chilled but their temperature is 99, 8 degree F, 37, 7 degree C. What should the PCT do? A. Assume the patient is imagining the chill. B. Remove extra blankets immediately. C. Offer the patient more blankets and notify the nurse. D. Recheck the temperature in 1 hour. Answer, C. Offer the patient more blankets and notify the nurse. This question addresses patient comfort and recognizing subtle changes. The patient feels chilled despite a slightly elevated temperature, low-grade fever. Providing blankets addresses the patient's immediate comfort complaint, the chill. Notifying the nurse is crucial because the elevated temperature and feeling of chill could indicate the beginning of an infection or other illness that requires assessment. It's important to address patient comfort while also alerting the nurse to potential clinical changes. For example, the patient might be starting to develop a fever and needs monitoring. Respond to patient comfort needs and report potential issues. Question 32. What is the primary function of red blood cells? A. Fighting infection. B. Carrying oxygen from the lungs to the tissues. C. Clotting blood. D. Transporting nutrients absorbed from the intestines. Answer, B. Carrying oxygen from the lungs to the tissues. This question tests basic knowledge of hematology, blood components. The focus is on the primary function of red blood cells, RBCs. RBCs contain hemoglobin, a protein that binds to oxygen in the lungs and transports it throughout the body to supply tissues and organs. White blood cells fight infection, platelets help with clotting, and plasma transports nutrients. For instance, a low red blood cell count, anemia, leads to fatigue because the body isn't getting enough oxygen. Remember, red cells are the oxygen couriers. Question 33. When performing surgical hand antisepsis, how long should the PCT scrub their hands and forearms? A. 15 to 30 seconds. B. 1 minute. C. 2 to 6 minutes. D. 10 minutes. Answer, C. 2 to 6 minutes. This question addresses surgical asepsis techniques. The keywords surgical hand antisepsis and how long scrub are important. Surgical scrubbing requires a more thorough and longer duration than routine hand washing, typically lasting 2 to 6 minutes, to eliminate transient microorganisms and reduce resident flora effectively. Shorter durations are insufficient for surgical preparation. For example, scrubbing each finger, hand, wrist, and forearm systematically for the required time ensures maximum cleanliness. Surgical scrubbing takes time, aim for the 2 to 6 minute range. Question 34. Which position is typically recommended for performing a rectal temperature check? A. Supine with knees bent. B. Dorsal recumbent. C. Sims position, lying on the left side, left hip and knee bent. D. Fowler's position. Answer, C. Sims position, lying on the left side, left hip and knee bent. This question relates to specific patient care procedures and positioning. The keyword rectal temperature indicates the need for a specific position. The Sims position, where the patient lies on their side with the upper leg bent towards the chest, exposes the anus adequately and allows for comfortable and safe insertion of the thermometer. Other positions are not suitable for this procedure. For example, this position helps relax the rectal sphincter slightly. Sims position is the standard for rectal procedures. Question 35. What should a PCT do if they find a patient wandering in the hallway confused? A. Gently lead the patient back to their room and leave. B. Ignore the patient as they might be trying to walk. C. Ask the patient where they are going and assist them back to their room. D. Call security immediately. Answer, C. Ask the patient where they are going and assist them back to their room. This question tests the PCT's response to a patient safety issue involving confusion and wandering. The key is to ensure the patient's safety while respecting their needs. Asking the patient their destination offers insight into their intent and allows the PCT to assist them appropriately, potentially back to their room if they are disoriented. Simply leaving them, ignoring them, or immediately calling security might be unnecessary or inappropriate without initial interaction. For example, the patient might just be looking for the bathroom. Always approach confused patients calmly and inquire about their needs. Question 36. A patient requires range of motion, ROM, exercises. What is the PCT's role? A. To perform all passive ROM exercises without guidance. B. To assist the nurse in performing active or passive ROM exercises as directed. C. To instruct the patient on how to perform the exercises independently. D. To document the patient's range of motion capabilities. Answer, B. To assist the nurse in performing active or passive ROM exercises as directed. This question clarifies the PCT's role in physical therapy interventions. The focus is on range of motion, ROM, exercises. PCTs typically assist the nurse or physical therapist with ROM exercises, performing them passively, moving the patient's limb B, or assisting the patient with active exercises. Patient moves their own limb B, strictly following the plan developed by the nurse or therapist. They do not independently prescribe or perform all exercises. For example, the PCT might gently move a patient's leg up and down as instructed by the nurse. Assist with ROM exercises only under supervision. Question 37. What does the term hypertension refer to? A. Low blood pressure. B. High blood pressure. C. High blood sugar. D. Slow heart rate. Answer, B. High blood pressure. This question tests understanding of basic medical terminology. The keyword is hypertension. Hypertension is the medical term for consistently elevated blood pressure, meaning the force of blood against the artery walls is too high. Low blood pressure is called hypotension, high blood sugar is hyperglycemia, and a slow heart rate is bradycardia. For example, a reading consistently above 130/80 mmHg is often considered hypertension. Remember, hyper means high, and tension relates to pressure. Question 38. How should sharps, like needles and lancets, be disposed of immediately after use? A. Recapped and placed in a linen hamper. B. Dropped into a puncture-resistant biohazard sharps container. C. Placed in a plastic biohazard bag. D. Left on the bedside table for later disposal. Answer B. Dropped into a puncture-resistant biohazard sharps container. This question pertains to safety procedures for handling contaminated sharps. The keywords sharps and immediately after use are critical. Used needles, lancets, and other sharp objects must be placed directly into a designated, puncture-resistant sharps container to prevent accidental needle sticks, which can transmit infections. Recapping, linen hampers, or plastic bags are unsafe disposal methods. For example, after using a fingerstick lancet, it goes straight into the sharps bin. Never recap used needles. Dispose of sharps safely at the point of use. Question 39. Which instruction should a PCT give a patient before collecting a clean catch urine specimen? A. Void continuously until the cup is full. B. Start urinating into the toilet, then collect the sample. C. Drink a large amount of fluid right before collection. D. Hold your breath during collection. Answer B. Start urinating into the toilet, then collect the sample. This question focuses on the correct technique for a clean catch midstream urine collection. The keywords clean catch urine specimen are essential. The process requires the patient to first urinate a small amount into the toilet, to clear the urethra, then collect the midstream portion in the sterile container, and finally finish voiding into the toilet. This method minimizes contamination from skin bacteria. Options A, C, and D describe incorrect procedures. For example, collecting only the first part or the last part could lead to inaccurate results. Remember to void first, then collect the middle part. Question 40. What is the normal range for adult systolic blood pressure? A. Less than 90 millimeters of mercury. B. 90 to 120 millimeters of mercury. C. 120 to 130 millimeters of mercury. D. Greater than 140 millimeters of mercury. Answer B. 90 to 120 millimeters of mercury. This question tests knowledge of normal vital sign values. The specific value is adult systolic blood pressure. Systolic pressure, the top number in a blood pressure reading, represents the pressure in the arteries when the heart beats. The typical normal range for adults is generally considered to be between 90 and 120 millimeters of mercury. Readings below 90 or above 130, diastolic below 80 or 90, are usually considered abnormal. For instance, a reading of 110/70 mmHg falls within the normal range. Keep the normal systolic range in mind. 90 to 120. Question 41. A PCT is assisting a patient who is weak and unsteady. Which type of footwear is most appropriate for the patient? A. Loose-fitting slippers with open backs. B. High-heeled shoes. C. Shoes with laces tied tightly. D. Well-fitting shoes with non-skid soles. Answer D. Well-fitting shoes with non-skid soles. This question focuses on patient safety related to footwear. The keywords weak and unsteady indicate a high fall risk. Well-fitting shoes with non-skid soles provide stability and traction, reducing the likelihood of slipping or tripping. Loose slippers or high heels offer poor support and increase fall risk, while untied laces are a tripping hazard. For example, shoes that grip the floor help prevent the patient from sliding, especially when walking. Choose footwear that maximizes safety and stability. Question 42. What does HIPAA primarily protect? A. The quality of medical care provided. B. The financial information of healthcare facilities. C. The privacy of patients' health information. D. The safety protocols in hospitals. Answer: C. The privacy of patients' health information. This question revisits the critical regulation HIPAA. The core concept protected is patient privacy. HIPAA, the Health Insurance Portability and Accountability Act, establishes standards for protecting sensitive patient health information, PHI, from being disclosed without the patient's consent or knowledge. It governs how health information is used and shared. For instance, a PCT cannot share patient details with family members unless authorized. Protecting patient confidentiality is a cornerstone of healthcare practice. Question 43. A patient needs assistance transferring from the bed to the chair. The patient can bear some weight but is unsteady. What is the best transfer method? A. Full lift using a mechanical lift. B. Dependent transfer with two-person assist. C. Squat pivot transfer using a gait belt. D. Independent transfer without assistance. Answer: C. Squat pivot transfer using a gait belt. This question assesses the PCT's knowledge of safe patient transfer techniques based on patient ability. The keywords "bear some weight but unsteady" suggest the patient needs assistance but can participate. A squat pivot transfer with a gait belt allows the patient to help push up while the PCT supports and guides them, using legs and the belt for stability. A mechanical lift is for patients unable to bear any weight, and an independent transfer is unsafe here. For example, the PCT stands facing the patient, places the belt, bends knees, and helps the patient stand briefly before pivoting to the chair. Choose the transfer method appropriate for the patient's weight-bearing ability. Question 44. What is the purpose of the Heimlich maneuver, abdominal thrusts? A. To clear an airway blocked by a foreign object. B. To stimulate breathing in a non-breathing patient. C. To restart a stopped heart. D. To control severe bleeding. Answer: A. To clear an airway blocked by a foreign object. This question pertains to emergency procedures. The key phrase is Heimlich maneuver or abdominal thrusts. This maneuver is performed to dislodge an object obstructing the airway when a person is choking and cannot cough, speak, or breathe effectively. CPR is used for cardiac arrest, and direct pressure for bleeding. For example, if someone is choking on food and clutches their throat, abdominal thrusts may be needed. The Heimlich maneuver clears the airway during choking. Question 45. Which of the following is a sign of a potential latex allergy? A. Increased thirst. B. Redness, itching, or rash at the point of contact. C. Difficulty swallowing. D. Nausea and vomiting. Answer: B. Redness, itching, or rash at the point of contact. This question focuses on recognizing adverse reactions. The keyword latex allergy points to specific symptoms. Exposure to latex can cause allergic reactions ranging from mild skin irritation, redness, itching, rash, at the contact site to severe systemic reactions. The other symptoms listed are not typically associated with latex allergy. For instance, wearing gloves might cause itching or hives on the PCT's or patient's hands. Be aware of skin reactions when using latex products. Question 46. When measuring the circumference of an arm or leg, where should the measuring tape be placed? A. Tightly wrapped, compressing the limb. B. Loosely placed, allowing easy movement. C. Snug but not constricting, at the specified landmark. D. over clothing layers for comfort. Answer C. Snug but not constricting, at the specified landmark. This question relates to accurate measurement techniques. The keywords measuring circumference indicate the need for precision. The tape measure should be placed snugly around the limb at the correct measurement point, e.g., midpoint, largest point, without indenting the skin or being too loose, ensuring an accurate and reproducible measurement. Constriction or looseness leads to incorrect readings. For example, measuring leg swelling requires a snug tape measure at the widest point. Accurate measurements depend on proper technique. Question 47. A patient has a fecal impaction. What is the PCT likely to assist with? A. Administering an oral laxative. B. Performing a digital rectal exam to check for the impaction. C. Assisting with the removal of the impacted stool via digital stimulation or removal. D. Providing an enema containing oil. Answer C. Assisting with the removal of the impacted stool via digital stimulation or removal. This question pertains to assisting with elimination needs. Fecal impaction involves a large, hard mass of stool that cannot be passed. While laxatives or oil retention enemas might be ordered, the PCT's direct role is often assisting the nurse with the physical removal, which may involve lubricating a gloved finger and carefully breaking up and removing sections of the impacted stool. This procedure requires specific training and physician/nurse direction. For example, the nurse might perform the removal while the PCT provides necessary supplies and support. Assisting with stool removal is a common task for impactions. Question 48. Which statement best describes the principle of standard precautions? A. Treat all patients as potentially infectious, implementing basic safety measures. B. Use airborne precautions for all respiratory illnesses. C. Wear gloves only when visibly soiled. D. Assume only patients with diagnosed infections require precautions. Answer A. Treat all patients as potentially infectious, implementing basic safety measures. This question tests the understanding of fundamental infection control principles. Standard precautions are the minimum infection prevention practices that apply to all patient care, assuming every person could potentially carry infectious agents. This includes hand hygiene, PPE use, respiratory hygiene, and safe injection practices. Options B, C, and D describe incorrect or incomplete application of precautions. For example, hand hygiene should be performed before and after patient contact regardless of diagnosis. Standard precautions are universal precautions for safety. Question 49. What is the primary reason for using a draw sheet when repositioning a patient in bed? A. To absorb moisture and keep the skin dry. B. To prevent pressure injuries by increasing cushioning. C. To facilitate movement and reduce friction on the patient's skin. D. To provide a surface for taking vital signs. Answer C. To facilitate movement and reduce friction on the patient's skin. This question focuses on patient mobility and preventing skin damage. The keywords draw sheet and repositioning are key. A draw sheet, or lift sheet, is placed under the patient and used to help move or turn the patient in bed. It works like a slider, allowing the PCT to move the patient with less friction and shearing force against the skin, which helps prevent skin breakdown. While it can absorb some moisture, its primary purpose in repositioning is reducing friction. For example, using the draw sheet to pull the patient up towards the head of the bed prevents the skin on their back from dragging. Use draw sheets to slide, not drag, patients. Question 50. When measuring vital signs, which sequence is generally recommended? A. Temperature, pulse, respiration, blood pressure. B. Pulse, temperature, blood pressure, respiration. C. Blood pressure, pulse, temperature, respiration. D. Pulse, respiration, temperature, blood pressure. Answer: A. Temperature, pulse, respiration, blood pressure. This question asks about the typical order for taking vital signs. While the exact order can sometimes vary based on patient condition or facility policy, a common and logical sequence is temperature, pulse, respirations, often counted together before taking BP, and then blood pressure. This order allows for efficient assessment, grouping related respiratory/circulatory measures. For example, counting respirations while the patient thinks you are still taking their pulse is a common practice to get a more accurate, less influenced reading. A standard sequence ensures thoroughness.